Hi, I'm Dr. Michael Ches. I'm a pediatric epileptologist here to talk to you about cenobamate, also known as Xcopri, on behalf of the Lennox-Gastaut Foundation. Next slide, please. What is it? Cenobamate is a new medication which has shown good effect with potential against many types of focal and secondary generalized or generalized epilepsies. It is not specifically at this time approved for Lennox-Gastaut syndrome. It is currently approved for patients 18 years of age and older by the FDA. There are studies going on to study pediatric use and also possible use in Lennox-Gastaut syndrome. It has a unique mechanism of anti-seizure actions, and it has a presynaptic slow sodium channel effect and a pre and postsynaptic GABA effect. And this makes it unique by having more than one mechanism with broad spectrum that helps both focal and generalized seizures, but more importantly, a postsynaptic GABA effect is unusual and different than most of our existing epilepsy drugs to date. Next slide. And who is it for? Currently, it's for adults with partial seizures or secondary generalized seizures who are greater than 18 years of age, as I mentioned. It only comes orally and does not have an intravenous or IV format. It needs titration slowly because there's a potential, if you go too fast, to cause a rare dangerous rash, such as a Stevens-Johnson reaction, which can be very serious and even fatal if not caught in time, because it can severely damage your skin and make it severe damage to where you cannot survive. However, that's a very rare reaction, and only if you keep taking the medicine. It's not going to happen if you stop the medication quickly and treat the rash right away. Now, they've never seen it happen to anybody who increases this drug no faster than every 2 weeks. It starts at a very low dose and it goes up slowly. A nice thing about this medication, it comes in titration packs where you get 2 weeks of one dose and 2 weeks of another, and then you get the next 2 weeks and the following 2 weeks the same way as you increase the dose. So it's very hard to make an error as you're titrating up the medication. The medication has a long half-life. It lasts over 60 hours. So it tends to be a once-a-day dose, and it's recommended to take it once a day at bedtime. It's not overly sedating, although it can cause sedation in patients as it gets to higher doses. And many people responded to 200 milligrams, but it can go up to 400 milligrams a day, although side effects increase as you go up. And of course, for younger or smaller people, it may be a lower dose. It just hasn't been fully approved by the FDA at that level. It's good for focal and generalized convulsive seizures. I mentioned it is unknown what it does for absence seizures, atypical absence seizures, tonic or atonic seizures, or myoclonic seizures. And for those who are older adults with LGS who may have known injury or brain malformation or have focal or tonic-clonic generalized seizures, or even younger patients with those things, this may be a very effective drug in the armament against the different types of seizures that can occur in LGS and the spectrum of developmental epileptic encephalopathies. Next slide. So why would you decide to try this medication? If you failed other medications, it's got initial improvement where the trials had a 75% improvement over placebo. And also there was a 24 to 30% seizure freedom during the trial at different doses, which is unusual for drug trials to have that much seizure freedom. Usually it's more like 10% or less in typical trials. Older patients with focal or secondary generalization, or younger patients with those type of seizures who have aged out of, say, atypical absence or tonic seizures may benefit from this medication, especially for the convulsive type seizures they have. And it may be effective for a range of different seizure types because there are 3 mechanisms involved, giving a very broad spectrum of effect. And it may be able to replace other medications that the patient may be on, with one medication doing 3 things instead of 3 medications doing 3 different things. And it has the unique post-GABA synaptic effect as opposed to the presynaptic effect only that, say, drugs like clobazam may have a presynaptic effect, but this has a pre and a post-GABA effect. Next slide. What would concern you about trying this? Well, again, it's approved to get insurance to pay for anyone under 18 years of age has to have a lot of data to support the need to try that. So it's off-label use. The risk of a rash, if you rush the titration or take it too quickly, could occur, but has not occurred yet if going slower every 2 weeks. There's other side effects. As it goes up, it can cause dizziness. It does interact with other medications. And so you need to monitor the medications you may be on, especially if you're on a sodium channel drug. You may need to lower those, something like Vimpat or any of the Tegretol, Dilantin, phenobarbital, Lamictal group could interact. And then also it's similar in some ways to the family that Felbitol comes from. So you want to know what drugs you're on and how they may interact. It seems to be not really affected by those drugs as much. You can get fatigue as the major complaint, dizziness as the other major complaint. And we also have several patients who've lost a significant amount of weight. Typically they were overweight and this was good for them, but it is a concern if you see someone losing a significant amount of weight on this drug. It does seem to have a weight loss side effect that isn't as highly talked about in the trial data, in the real world experience that I've had and others are expressing. Nothing that's become life-threatening or concerning, but it is definitely something to warn patients about, that they might see a significant weight loss of 10 to 40 pounds or more in some patients who are overweight. But if it affects seizures in a positive way, it may be a good thing for those patients to lose weight if they're already obese or overweight. As we know, many of the medications that they take cause them to gain weight. So this may be a benefit for patients who've gained weight on other medications for behavior or for seizures. So it has to be balanced with that knowledge for a given individual. Next slide. So what else would be helpful to know? Well, it'd be nice when we get pediatric data and safety information and see if the pharmacology with the long half-life is similar to the adults, which it probably will be. And also trials in Lennox-Gastaut syndrome or developmental epileptic encephalopathies may be useful as well. It may inspire other dual action medications in the future. And also there are other drugs that in research trials or in animal models have helped Lennox-Gastaut type models. A drug it's related to is the family it comes from. Cenobamate is in the family of meprobamate and Felbitol, which is LGS approved. So there may be some effect in LGS going forward, but the testing needs to be really done in a clinical trial basis. But it is hopeful that drugs of this family may have some effect in LGS, and we'll find more in the future as more research is done. Next slide. To find out more about cenobamate and other information about LGS, please visit the lgsfoundation.org website. Thank you.